Dear Chairman, ladies and gentlemen, my name is David Ozretić. I am a neuroradiologist at the University Hospital Center in Zagreb. The topic of my presentation is the formation of endovascular stroke service network in Croatia. It is well known that stroke is the third leading cause of avoidable deaths in the European Union and a leading cause of disability. So in the last few years, mechanical thrombectomy has emerged as minimally invasive endovascular technique and became a leading method of treatment of patients with ischemic acute stroke and occlusion of large vessels. It has also become one of the most effective medical treatments available. Number needed to treat is it's just 2.6. That means 1 in 2.6 patients are helped with this treatment, and this means they are less disabled at 90 days. So it is of paramount importance to make this technique available to all European Union citizens, especially in countries with high stroke rates and high death rates from stroke, such as Croatia. So here is a most recent table from Croatian Health Statistics Yearbook, indicating that cerebrovascular diseases are second leading cause of death in Croatia in 2018. Interventional neuroradiology as a discipline that performs endovascular procedures in cerebral and neck vasculature has been established at the University Hospital Center Zagreb in 2003, dealing primarily with hemorrhagic stroke, mostly subarachnoid hemorrhage. First patient with ischemic stroke was treated with intraarterial thrombolysis in 2007. And since then, treatment techniques have been refined and improved, and more patients have been treated. We treated our first patient with mechanical thrombectomy in 2011. In 2015, 5 major randomized trials have been published, and since then, mechanical thrombectomy entered all guidelines and became a leading treatment modality in patients with occlusion of major intracranial arteries, and the therapeutic window of 6 hours has been established. It was clear from the beginning that many patients will be left outside of this therapeutic window because they live far from centers that can offer this kind of treatment. So in Croatia, our network of highways is well developed, but still it takes more than 3 hours, sometimes 5 hours from eastern or southern parts of country to reach Zagreb, to reach our center. So we established a plan and we offered our idea to Ministry of Health to organize a national stroke service, to organize a network of centers providing this kind of service, and to train the people, train the nurses, and all other physicians involved to offer this kind of effective therapy to all citizens of Croatia. So apart from Zagreb, where there are currently 2 endovascular centers, we designed a network of 3 more cities, major cities in Croatia that also have university hospitals that are Split, Rijeka, and Osijek. And we started the training, and we completed the training of the personnel in Split in 2018. So they are performing mechanical thrombectomy for 2 years now. Last year, we helped to establish a service in Rijeka, and they are also doing procedures on their own. And in 2020, in a few months, we will start service in Osijek. Their teams are already under training in our university hospital. So in last year, in 2018, about 300 patients have been treated with mechanical thrombectomy in Zagreb, with additional 80 patients in Split and about 50 patients in Rijeka. But although the number is significantly increased from 2015, but this is still about 50% of the target rate of 5% of all stroke patients in Croatia. We can see on this table that was published in European Stroke Journal in 2019, based on a survey done by a European Stroke Organization in 2017, when they advised that Croatia should have 2 more endovascular centers, and that time we had just 2 in Zagreb, and that additional almost 1,000 thrombectomies should be performed in 1 year. At that time, we reported only 30 patients. We significantly improved since then, but still our numbers are still halfway to the optimal and desirable numbers. So in conclusion, good planning and effective treatment are responsible for endovascular stroke treatment, and today is available to 3/4 of Croatian population, reducing the mortality and permanent disability. But still, there is a long way ahead of us. This is a table from, again, Croatian Statistical Health Yearbook from 2018, and we see the data from the difference of standardized stroke rate, death rate from stroke in 2015, and a significant decline in stroke rate, in death rate from a stroke in 2016. We believe that this has something to do also with our endovascular treatment, but we hope that the numbers will be better when the results come for other years in 2017 and 2018, because still when we are compared with the average death rate from stroke in European Union, we are still twice worse. We have twice as many deaths as in European Union, not to compare with some well-developed countries in stroke organization as Austria. So thank you for your attention.